Bismillah ar-Rahman ar-Rahim. Today I will discuss with you some clinical hints about blood disease. First of all, I would like to introduce myself. I am Dr. Suzy Abd El Mabood, Associate Professor of Pediatrics, and my subspecialty is Pediatric Hematology, Oncology, and Bone Marrow Transplantation Unit. These are the contact details and the academic hours I have. So what is the content of this lectures? We have some symptoms of blood diseases, some signs commonly presented in patients with blood diseases, and some investigations commonly requested for patients suffering from blood disorder, and what are the difficult terms. So the learning outcomes from this lecture include what are the definition of blood diseases, what is the common symptoms that the patient may be presented in cases of blood disorders, what is the signs, common clinical signs that the doctor or the physician may find in patient with blood diseases, and what are the investigations commonly requested for patients with blood diseases, and finally, what are the difficult terms we have in blood diseases. What are types of blood diseases? Blood disorders means that it can affect any of the three main components of the blood. So blood diseases may affect the red blood cells, which carry the oxygen to the body tissue, as you know, or affecting the white blood cells, so affect its ability and efficacy to fight for infections, so this patient will be more susceptible for infections, or affecting the platelet, which have an integral part in cases of hemostasis, as you know. So this will lead to bleeding tendency. Also, blood disorders may affect the liquid portion of the blood, which is called the plasma, which also contain coagulation factors, which very important in the process of hemostasis after platelet rule. We will discuss one of the common blood disorders through a case scenario. Mona is a 5-year-old girl suffer from high-grade fever lasting for 3 weeks, followed by pallor, and her appetite is much declined with weight loss. She complains of pain in both upper and lower limb. In the last 3 days, she developed purpura and ecchymosis in different parts in the body with occasional epistaxis. We can discuss this through also the physical examination. She is ill and pale, so the physician noticed that she is ill and pale. She has multiple purpura and ecchymosis in the face and extremities, and the cervical lymph node are palpable and enlarged, which means that the lymph node in the neck, called the cervical lymph node, and during abdominal examination, there is diffuse abdominal enlargement, and on palpation, hepatomegaly and splenomegaly were noticed. Symptoms of the blood disorders. What are the common symptoms here found in this case scenario related to the blood disorder? First is the high-grade fever that lasts for a long time, for 3 weeks or more. Second is the pallor, the presence of pallor, one of the also common symptoms of blood disease. Presence of pain in the both upper limb and the lower limb, so presence of pain affecting the bone, which is called the bone aches. Also presence of purpura and ecchymosis, which denote that there is bleeding tendency in the different part of the body. And finally, orificial bleeding, which is bleeding from body orifices, like the epistaxis, which is bleeding bare nose. What are common signs of blood disorders that mentioned here in this case? Ill and pale, also, it's a physical sign that the physician may notice that the patient is ill and the patient is pale. There is a manifestation of bleeding tendency like purpura and ecchymosis in the skin. Cervical lymph node enlarged, which is called the cervical lymphadenopathy, which is the lymph node in the neck is enlarged and palpable. And the abdominal examination found hepatosplenomegaly. These are pictures for berbera and ecchymosis, which are subcutaneous hemorrhages. The berbera means that minute subcutaneous hemorrhages, denoting a platelet disorder. So usually berbera is linked to the presence of platelet disorder, either decrease in the platelet number, which is called the thrombocytopenia, or decrease in the platelet function, which is called the thromboasthenia. What is BTK? Here pointed in the picture, BTK means a small berbera, very minute berbera of less than 3 millimeter in diameter. What about ecchymosis? Ecchymosis is larger subcutaneous hemorrhages, started as bluish or violaceous discoloration, and then fade gradually to greenish discoloration, then yellowish discoloration, and finally fade away. Presence of berbera and ecchymosis denote that this patient may have bleeding tendency, and one of the causes of this bleeding tendency may be related to platelet disorder, either, as we said, number, thrombocytopenia, or function, which is thromboasthenia. Pallor also one of the symptoms and signs of presence of anemia. So the patient will be presented with pallor. The pallor can be noticed in the conjunctival fornix, as in this picture, or the inner lip, the inner aspect of the mucous membrane of the lip, the lower lip, also in the nail bed and in the palmar creases in the hand. Cervical lymphadenopathy means enlarged cervical lymph node in the neck, like this picture denoting presence of cervical lymphadenopathy. The boy shows cervical lymphadenopathy affecting the left side of the neck, and the girl shows cervical lymphadenopathy affecting the right side of the neck. Also, splenomegaly, normally the spleen is not palpable. If it's enlarged, it will be palpable in the left hypochondrium. According to its size, may be larger, occupying the left hypochondrium and the left lumbar region, and may be hugely enlarged up to the level of the umbilicus. So it's palpable in the left side of the abdomen if it's enlarged. Hepatomegaly may be liver normally palpable, but when it's enlarged, it will be larger in size, occupying the epigastric region, and the right hypochondrial region may be enlarged to be palpable also in the right lumbar region. What are the difficult terms? What's high-grade fever? What's meant by high-grade fever? That's a temperature of more than 39 degrees centigrade. What's meant by that the fever is lasting for more than 3 weeks, however there is no obvious cause. It's called pyrexia of unknown origin, and one of the differential diagnoses of pyrexia of unknown origin that the patient may have malignancy anywhere, and commonly in cases of leukemia especially. Appetite is much affected, so it's called anorexia. Pallor, which means that whitish discoloration of the skin and the mucous membrane. Pain in the bone, as we said, it's called the bone aches, as the patient has pain in both upper and lower limb. Berbera means minute subcutaneous hemorrhages of less than 1 centimeter, as we see in the pictures. Ecchymosis, subcutaneous hemorrhages larger in size, starting with a bluish discoloration, then fade away gradually with color changes till disappearance of the changed color. Lymphadenopathy means that the lymph nodes are enlarged. Hepatomegaly, the liver is enlarged. Splenomegaly, the spleen is enlarged. What are the investigation will be requested for this patient? First of all, CBC, complete blood count, to determine the degree of hemoglobin. What about the number of white blood cells? What about the number of the platelet? So it's expected that this patient has decreased the hemoglobin level, which is called anemia, decreased the platelet count because she has a manifestation of bleeding tendency manifested by presence of berbera, ecchymosis, and the orificial bleeding like epistaxis. So it's called the thrombocytopenia. Another entity, but not found here, if you have a case of increased platelet count, it's called the thrombocytosis. Also, the white blood cell count may be increased in this case, especially maybe leukocytosis. Increased white blood cell count means leukocytosis, or decreased white blood cell count, which is called the leukopenia. And maybe the white blood cell count here in this case especially may be normal. This is because of her case. Okay. So bone marrow is done for this patient, bone marrow aspirate, and revealed that there is abnormal cells, malignant cells, which is called the blast cells in the bone marrow, and the final diagnosis was acute leukemia, which is the most common childhood malignancy. So these are some questions to examine yourself or to test yourself about this lecture. The decreased hemoglobin level is called. So when hemoglobin is low, says this patient has anemia. Also, the manifestations of thrombocytopenia include purpura, ecchymosis, or orificial bleeding like epistaxis, hematemesis, or all of the above. Of course, it's all of the above because it's a case of bleeding tendency. Also, manifestation of leukemia, as we see in this case, may be pyrexaphone origin, maybe pallor, maybe purpura, maybe lymphadenopathy. So, of course, it's all of the above. This is a summary for the blood diseases which can affect any part of the blood element, RBCs, white blood cells, platelet, or plasma. Common symptoms for blood disorders may be fever, pallor, abdominal enlargement, bone aches, lymphadenopathy. Okay. Common signs: pallor, purpura, ecchymosis, or hepatosplenomegaly or lymphadenopathy. Common investigations requested for this case may be CBC, of course it's important, bone marrow aspirate if I suspect leukemia, or coagulation profile if I suspect bleeding tendency. Thank you very much, and these are the references I used during my topic.